So just a little bit of background on AHRQ and why what is our role in helping to address these objectives. Our mission is to improve the quality, safety, efficiency, and effectiveness of healthcare for all Americans, and we do that by supporting research that helps people make more informed decisions, for example, about cancer screening, and improves the quality of those services. And we also work to translate that knowledge into guidelines, tools, and so forth that people can use to improve safety and quality. Most of our work is done through our grants and contracts. Next. Now, many of you are familiar with the U.S. Preventive Services Task Force. This is an independent group of national experts in prevention and evidence-based medicine. I believe it is close to 30 years old. Was originally started by the Office of the Assistant Secretary for Health, moved to AHRQ in 1995. It's an independent group of national experts in prevention and evidence-based medicine, and they develop recommendations on clinical preventive services such as screening, counseling services, and the use of preventive medicines. By law, AHRQ convenes the task force and provides scientific and administrative support of its operations. Next slide. So the task force itself systematically reviews evidence for clinical preventive services implemented in a primary care setting. By and large, the task force is addressing whether this is recommended for people walking in not with a specific complaint or a specific risk factor, but just all comers. And these recommendations are intended to help primary care clinicians and patients decide together whether a preventive service is right for that individual's needs. And if you want to learn more, they have their own website, very big mouthful, U.S. Preventive Services Task Force, all one word, .org. I believe it is case insensitive, but they're easy to find. Next. Now, the task force's recommendations are important to many of the objectives in Healthy People 2020. Relevant to our review today, they've made several recommendations for screening, counseling, and preventive medications to reduce cancer rates or to help identify cancer earlier. Two of their recommendations are listed on this slide: screening for cervical cancer and counseling young people to reduce their exposure to UV radiation. Just a brief note about the cervical cancer recommendation. Significant because the task force, which has an ongoing commitment to update their recommendations at least every 5 years, sometimes more frequently as new evidence emerges, actually did this in very close collaboration with both partners within HHS and partners in the broader healthcare community, the American Cancer Society, American College of OBGYN, and so forth. This was the cervical cancer. And at the bottom of the slide are just the two of the Healthy People objectives supported by these recommendations. Next slide. So as Dr. Corey mentioned, the task force's recommendation on genetic counseling for women with an increased risk or BRCA1 or BRCA2 served as the foundation for the objective G1. And their recommendation is seen on this slide and notably is currently being updated. And it's being updated, and this is a little salute to the task force and my colleagues who support their work, very consistent with the task force's new approach to transparency at all phases of the process. So from the very moment that they decided to do an update, they convened stakeholders and got their input really at time zero. They got input on the key questions that would be addressed by the systematic review that we support, and then the draft recommendation is out for public comment and so forth. I don't believe it's out yet, but it will be. That's the new process. And I have to say that groups were very, very helpful with this recommendation. Next. So as a result of the Affordable Care Act, let me just say everyone is extremely interested in the Preventive Services Task Force because the A and B recommendations from the task force, along with recommendations of three other groups, ultimately guide Medicare, Medicaid, and private insurance companies to increase access to clinical preventive services and to ensure that they are affordable, by which I mean no copayment for these recommended services. So you can see that whatever rating it gets a lot of attention. And it particularly gets a lot of attention because the American public has very strong and generally extremely enthusiastic feelings about all preventive services. We know from Medicare, for example, when preventive services used to be covered, literally requiring an act of Congress, sort of one at a time, that just because you're covered doesn't mean that people take advantage of the service. So we have funded a variety of research activities to help implement the recommendations in other settings. So, for example, in our work, and we've been collaborating quite a bit with Dr. Koh's office on this, improving care for people with multiple chronic conditions. Multiple studies have found that if you've got multiple chronic conditions, often effective evidence-based screening kind of gets left off the agenda, partly because there's other issues to address and so forth. So our Center for Advancing Equity in Clinical Preventive Services at Northwestern University is developing and testing interventions to address that very gap and working very closely with FQHCs in the Chicago area. Next slide. Now, tools for implementation. If it's just a recommendation in a journal article or on a shelf somewhere, it doesn't help very much. We still support the development of a clinical guide. It turns out clinicians like to have something to put in that proverbial white coat pocket, so we do that. We also have something I think is much snappier, which is an electronic preventive services selector, which you can do online, or you can get download a free app to your iPhone or other smartphone and so forth. For a while, it was the leading free app for the iPhone. I definitely have to say something about My Health Finder, where there's some terrific information for consumers about these recommendations. And there are also consumer fact sheets and so forth. And we work very closely, and the task force especially works very closely with communications professionals to make sure that they're addressing the key issues of concern to the public. Next slide. And finally, I just want to highlight a unique tool originally developed by AHRQ but now implemented by the CDC. We developed a computer-based clinical decision support tool to facilitate shared decision-making between clinicians and women at risk of breast or ovarian cancer. The tool was developed to support the task force's recommendation on genetic counseling. CDC's Division for Cancer Prevention and Control picked up the concept and implemented it as Body Talk. So thank you to my colleagues from the CDC. It has two interfaces. One is a patient portion of the tool, which was designed with the idea in mind that patients would actually think about this ahead of time before their visit, allowing them to be fully informed about the conversation that's going to happen. The clinician interface allows that clinician to review the patient's history and provides resources for referring these high-risk women to the appropriate specialist. And the tool is really, I think, a very nice illustration of the kind of conversation that really needs to happen between patients and clinicians to make sure that patients get the most appropriate clinical preventive services for them and to make progress in increasing evidence-based screening and reducing cancer death rates.